would be called back this Saturday.
All right, I'm going to transition to the other camera so we can be on the actual there.
I turned our camera off. Off or on? Off. Okay. I don't know if I'm in some. Okay.
Oh, Dr. Kane.
Yep.
So we have our demo, we have our training at 1:15 on a different call. So just so you know, this is the webinar call.
Okay.
So you should have received two. That's, I was thinking, I was like, I think this is.
It wasn't really. Okay, so at 1:15 is our deal, which.
Yes, you and I have our training call at 1:15.
Okay, do you know approximately how long that will take? We'll have to move some appointments.
At 1, we can do it right now. I can switch over and we can both get on the other call if you want.
You guys want to do that? If that works for you. And then
Sure.
we can do this webinar anytime or.
Yes.
Okay.
It'll be recorded.
Okay. Let's just do that if that works.
Okay. You should have received a Google Meet invite for the training that you and I are doing or that we had scheduled for 1:15.
Okay, I will go on that.
Okay, super. See you soon.
See ya.
Bye, Joanna.
Bye.
All right, good afternoon and good morning to some of you on the West Coast. This is Sean Gann with Genia USA. We're here today for the MV1 Seal and Cut webinar. And today is a little unique situation because we are at Dr. Tajmir's new clinic, which is super exciting. And we're going to go over the system, and he's also going to do a large dog spay, well, kind of a medium dog spay with us today. So you'll all be able to see applications, answer questions, talk about surgery protocols here. So first, I'm going to transition over to the other system so you can see the system. We're going to go through some of the programming, some of the settings in there, and see if you have any questions, and then we will go into the actual procedure itself. So give me 1 second to transition over there. All right. Can somebody let me know that you can hear me?
Yes.
All right, perfect. So just want to review some of the settings while they are getting set up for surgery here. Remember, this is your MV1 Seal and Cut. Your power button is here in the bottom left of the screen. You have this 4-inch digital screen to control any of your parameters that all plug into the front of the unit here. Do remember your grounding plate, which will be positioned on the table, is plugged in right here. This is the patient return electrode to use with the monopolar pencil. You will always see that it is connected by right up here when you have a status light saying prim. If this is unplugged, you'll see you get a red alarm and your grounding plate turns red. So that's definitely something that just to make sure everybody is aware of. And then we will kind of go into some of the actual protocols here so you can see these and talk through these. So when you first come into here, you can use your program manager. The program manager is designed to set up presets in here where you can load them and have your baseline presets for doctors or for surgeons' names. How you load them is just basically clicking the number 4 button and load, and then that will load your presets. This is Dr. Cashmere's system. So his presets automatically go to 30 in blend, 30 in soft. That's your monopolar settings. And then bipolar forceps on macro and L2 on his rapid seal. When you go into the generator, just remember you have adjustment in every quadrant. So when you click into here, you're going to see that you have adjustment for your wattage, which you can go up or down for your wattage value. You also can select any of these little modes down here. The low mode on the left is designed to cut thin tissue with zero coagulation built into that mode. Your pure mode is typically the one that your system should auto preset to. And this is going to be your scan incision or your fast-paced cutting mode that will have minimal coagulation built into that as well. It is a faster paced cut. Your blend mode, which his system auto presets to, is your mixture between cut and coagulation. So that is going to be your blend mode there whenever you're using the system. Endo is a pulse cutting technique that cuts, pauses, and coagulates if you have any needs for that. Just remember when you select them, it gives you a little description at the bottom to let you know what each one means. Dr. Cashmere does most of this cutting on blend, which is great. You also have your monopolar coag, which is the top right quadrant. So that is the blue button on your handpiece. When you drill into here, you still have your adjustment to be able to adjust your wattage up or down. And then you also have the 4 different modes of different coagulation. So soft is a delicate coag mode. This is a contact coagulation mode. This will allow you to be able to delicately coag thin tissue and not have an issue with burning through it. It typically does not spark when you touch the tissue. When you transition to Swift, that is going to be your standard coag mode. So this allows you to be able to coagulate when making contact, and that will give you your standard sparking technique whenever you touch the tissue to coagulate. You also have Folger and Spray. Folger and Spray are long distance coag, so that means not non-contact coagulation. You're hovering 1 or 2 millimeters off of the tissue, and that allows you to be able to, use this application for coagulation without making contact. So long distance, non-contact coagulation in Folger, and then Spray is just a little bit more power for long distance coag and more tissue coverage. A lot of times used with the ball and tip. If you wanted to select any of these, you will just touch it, hit back, and that's going to set it there. You'll see that the icon will update if you change your mode, or if you change your power and hit back, it will save it on the main screen. Do remember, if you're in the adjustment screen, the generator handpieces will not activate because this is in standby mode because we're telling the generator we're adjusting our wattage or we're adjusting our mode. So always make sure you click this back arrow to come back to the 4-quadrant screen. This is the screen for your bipolar forceps, your bottom left quadrant. You'll see in here we have 2 modes. We have a macro mode, which is a blend mode for your bipolar forceps. And this is just a cutting mode. You'll notice it has a wattage-based number. When you transition to the Smart Bicut symbol, you'll notice that your wattage number changes because in Smart Bicut, we're using the generator interface to control the power for us dependent on tissue. So we have a C1, C2, or C3 power level here, which is a low, medium, and high, all intended for your bipolar forceps. So remember, if you wanted to save it, you can do it this way. You also have your bipolar coag in the bottom right quadrant. So your micro, standard, and force settings, these 3 blue settings, are going to be BIP coag. So you'll see BIP cut on the bottom left, BIP coag on the bottom right. Remember, you have micro, standard, and force, your 3 different modes built into here, where micro is a low intensity, delicate coagulation for thinner tissues and forceps. Standard is going to be your most normal used icon here for a mode because that is going to give you your standard coagulation in between your 2 jaws. And then force is just a higher power mode for thicker tissues. Remember, your 3 blue icons are all in regarding to your bipolar forceps, not your vessel sealing clamp. So if you're on bipolar forceps, you can do this and it will select here and you'll see bipolar coag populates. You can change this bottom right quadrant to your vessel sealer by doing one of 2 things. Selecting the rapid seal icon, you'll see your vessel sealer port activates. or if you're on your bipolar forceps, port activates. But you can touch here, or if I have my foot pedal symbol on the bottom and I hold down the black button on the foot pedal, if I hold it down for 2 seconds, you'll notice it transitions that bottom right quadrant to the opposite handpiece. So it transitioned it to bipolar forceps. If I hold it down again, it's going to transition it to sealer, and you'll see the sealer port activates. Do remember on your vessel sealer, we have 3 different power levels. So L1 is designed for smaller tissues, so small patients. L2 is medium, L3 is large. And just click back to be able to save it. Any questions so far? We're getting the patient set up for anesthesia, so give us a second to get all set.
Sean, I do have a question about medium, large.
Yeah, go ahead.
Do you have kind of weight parameters that you use for that for patients?
It just depends. Most people do small, about 0 to 20 to 25 pounds. 25 to 60 is usually classified in the medium, and then anything above that is usually large.
Okay.
For your vessel sealer, you will notice that what that does is that changes your length of time that it's sealing. So meaning using your L2, L1, or L3. So it allows you to be able to trigger between that. Remember, your vessel sealing time, really you want it to be between 3 to 5 seconds.
Okay.
So yeah, that works. I'm going to let them get set up. So I'm going to move this camera real quick. So we'll be right back. If there's any other questions, let us know while they're getting this set up. More than happy to answer anything that we can go over for y'all. We're just getting set up for surgery now. So as soon as they get everything all set in place, then we'll be right back in the action. I am going to show you this because this is something that we do get many questions about, is how you pack your hand pieces. So in this application, you'll see that Dr. Tajmir and his staff, they double wrap all of their packs. They have their monopolar pencil inside of its own pack, with the tip inside of its own pack, the pencil in its own pack, and then they double wrap it so they can hand Dr. Tajmir his packs inside of this without touching them. So that's his monopolar pencil pack. This is his vessel sealer pack. So you will see that the vessel sealer and the cord are in an inside pouch. And then obviously added with a pouch on top of that. Remember, this vessel sealer, you want to make sure that your cord is detached from this and it's in the unlock position. Very, very important. Same thing, this is the lap handle, so which is still used in open surgery. So this has the tip, it has the cord and the handset all in an internal pouch and allows you to be able to have this sterilized and ready to go. Remember, all your cords, all your hand pieces can all go in your sterilizer, and they can all be set up with your sterilization side on that 250 degrees for 20 minutes and a 10-minute dry cycle. I can actually show y'all as well at the end of this. Any other questions so far on packing, cleaning, anything like that?
Quick question. Do you ever see people use just like pack wrapping instead of the disposable pouches, like the cloth?
Yeah, of course.
Okay.
Yep,
Just double wrap it
absolutely.
like you would instruments.
Same kind of thing, exactly. So if you use your washable wraps and you sterilize everything in that, or I've seen people put them in trays as well, you can do the same thing. You might just want to write on your sterilization tape on the outside what's inside. That's the only thing that sometimes can be a little bit hard to figure out what you got in there. But try to pack your cords and your hand pieces together. It does make your life a little bit easier, especially even in these pouches, knowing that you have the appropriate cord, tip, and the hand piece in the same pouch. But absolutely.
Okay, perfect. Thank you.
Of course. We're just getting set up now. Dr. Kashmir has all of his setup here. So he has this generator down here on a cart with all of his anesthesia equipment. And then everything will be transitioned right to over here. Does anybody have any questions about setup or anything like that? Yeah. How much does she weigh?
She's 50.
50 pounds.
Yeah. So people, one of the things people keep asking for, doing things real quick. You know, it's hard to read all the plan. Yeah, what do we do in these situations? How effective is it? Yeah, can you, oh, can you grab the sealer, please?
For anybody that's just joining, so we're just getting ready to go into the surgery here. We are doing a spay on a 50-pound dog, and Dr. Tashmir is just getting all set up. We're at his new clinic today, checking out all of his new space, and he's using the MV1 seal and cut on this spay.
Make sure I don't give the wrong hand away, which I've done before. You.
This is Dr. Tashmir's little trick that many of you have used and used in the past, but slipping your cord in there to be able to keep it from hitting the floor.
Hello, everybody. I don't know if
Dr. Tashmir,
rock on. Welcome to our lecture on how to do a spay. Just kidding. We're going to show you guys today in real time using the MV1 sealer. My name is Mike Tashmir. I've been working with Genia for about 2 years now. We got the second unit to ever come into the US, and we've been using it ever since. This is a great machine to use for everyday spays and neuters, and pretty much any surgery. If you do spleens, livers, that kind of stuff. 5, 10 again. So we use this thing pretty routinely. I will show you guys using this on a big dog or medium dog technically right now, but please don't judge any technique flaws you guys see with my spay. And if anybody has any doubts on whether this is real or not, full disclosure, this is my personal dog that we just got last week. And she is 6 months old, and she's getting ready to be around an intact male for a week. So rather than keep them together, you're going to get her fixed before that happens. And I'm not one of those people who can't talk while I cut at the same time. So if you have questions, please feel free to ask while I'm doing this.
yeah, this is supposed to be open forum for y'all. So
Yeah.
today's a little unique, obviously having a live surgery, which is great, but Dr. Tashmir is available if y'all have used the system multiple times and have any questions on technique, or if you have any questions on power settings, I can help you with. But we just wanted to give y'all another demonstration live to be able to see a medium dog spay in process, which is always great.
And get through the peritoneum, we will be great.
The mouth here.
Hmm?
The mouth here.
Yeah, that's fine. Sinus breaker. Or sinus tech. So, again, I have been using this machine for about 2 years now. That's not good. Of course, it's probably going to take me about 10 minutes just to find the uterus here today. We'll get there eventually.
Like we said, if anybody just joined, just let us know if you have any questions. We're just showing you a medium dog spay on Dr. Tajmir's new adopted pup.
Her name is Ocean.
Her name's Ocean.
She is great with everything, dogs, and the uterus does not want to come out.
This is always a question that we get as well because of how big your incision is. So this is good to see here. You can see Dr. Tajmir doing this smaller incision even on a medium dog.
So we use this machine, like I said, for a lot of things. Spays, neuters, splenectomies, mastectomies, other mass removals and things. And again, open forum, so I've been doing this, I guess, long enough where I can talk and walk and chew gum at the same time. So my technique is a one clamp. And there's a big vessel in here that I'm going to seal with this. And we are currently on an L2 setting as a reminder. One key thing we always like to point out when we do this, and it's awesome to show this in real time, is you guys can see here where the jaws are clamped, the tissue is all between the jaws. We never want to be in a situation where when we clamp, the tissue pushes beyond the jaws. We always want to have it where the tissue is all the way into the jaws. And between the plates 100%. Not touching anything. So seal is done. Release my clamp, cut my tissue. Check, looks good. Good to drop. And so when you have these big fatty broad ligaments, you can always use a sealer to go and seal. And then with these, I don't typically go too crazy. We'll just cut this as we go. And same thing as we get down here. So, and I'm just showing you this because just so you guys can see how easy it is to use.
And then you're hitting the blue pedal.
Yep.
While you do that.
Yep.
Remember, you hold down on the blue pedal, it'll have a solid beep whenever it's sealing, and it'll automatically shut off when it gets to the doo-doo-doo, which is the finish signal at the end.
Okay, yeah, we couldn't hear that.
Yep.
So there's a, and then what do you mean you're not touching anything? You just wanted to make sure you didn't burn some other tissue?
Yeah, I'm making sure I'm not touching the skin, or or I have this clamped by accident on the bottom.
Because your jaws do get warm, right?
Yeah.
So you just want to make sure it's not touching any adjacent tissue or the skin to where it would cause a burn.
Okay, thank you.
And we tell you this because I have done it all. So I have had, I've had tissue that's gotten burned. I've had, we grabbed something and like the skin got burned. It's not a big deal. It'd be just like if you're using your cautery.
Does the sealer not also cut, or it just
No.
have
No,
to-
it does not seal. That is the one difference between this and the ligature and the buoyant is the cutting feature. But I will tell you, time-wise and cost-wise, just especially cost-wise, it is not worth the value that you're ending up paying for the additional stuff. So you're just not getting, the cutting feature. Sorry, kid.
This is a great example. We talk about tension, right? So we just want to make sure that we don't have too much tension on that tissue when we are sealing it. All right, so we're going into application. He's locking across the tissue. He's holding the blue foot pedal down. It had a solid beep while it was sealing. And then it gave him the finish signal of your two-tone alert at the end. And then he released.
If you happen to be an anxious person, can you do like 2 little dips?
There's no reason to seal, especially over a previous seal. You create more tissue fragility, at which point then it would fall and your anxiety level would probably go from an 8 to an 11.
But if you just like, if I went where my clamp was.
Yeah,
like,
you can do that.
Yeah.
Okay.
But the tissue, you have to remember, the tissue that you seal proximal to your clamp is going to die off. And so that all that extra tissue is basically just going to die off.
Right.
But yes, I mean,
But you could
can.
do it, no problem.
if you want to do a double seal, if you double ligate, you just make sure that you give a little bit of fresh tissue in between your first seal and your second seal and go through the same application again.
So I'm going to use this as an example because this dog doesn't have its vessels and everything aren't as prominent. But if you were doing a big dog and the discrepancy between the uterine body and the vessels was really big, we would recommend doing what I call a 3-seal technique. So you would seal this one, you would seal this one, and then you would come back and seal the body. And
Yeah. With this side.
so that because the tissue discrepancy, you may not get one or the other when you go to seal.
You're like, oh my God. It looks silly. I'm trying to light a phone.
Yeah.
The uterine body is what I'm referring to, by the way. Okay, so again, uterine body now.
So you got
Let
to
that go.
finish signal.
Looks good and drop. And that is a sutureless spay.
Any questions, thoughts, anything we can answer?
On the West Coast, we do actually a lot of ovariectomies as well.
Yep. This would probably be a great tool for that.
What's that?
This would be a great tool for that.
So yeah, so we would just do the pedicle and then that little sweet spot between the ovary and the beginning of the horn, and just kind of 2 spots.
Yes. Yeah, I think that's honestly, if you're doing those, this would be a game changer for you, because you're sealing, and then you're taking, you're removing what you need to remove. You're not having to suture. The time factor alone. I do tell people pretty routinely, if you're doing these and you're doing a 6-minute spay or a 5-minute spay, or even if you're a sub 10, this isn't necessarily going to make you faster. If you have an associate who's doing 20, 30-minute stays or longer, this is going to make them a lot faster, especially once they get comfortable with it.
And remember, that's the benefit to this system. These hand pieces are built to be able to last, so you can use them on everything routine that you're usually ligating now. So your spays, your neuters, mass removals, obviously splenectomies.
Check and see, make sure. I think the glue should have came in. I'm sorry.
No.
Where would it be?
It may be out there. It's all right. Just have one and get it if it's there. If it's not in, no big deal. Sorry.
Oh, good.
But yeah, if you're doing this and you're doing ovaryectomies, it hasn't made it, all that popular out here yet, but every once in a while I'll get a client who is like, can we do an ovaryectomy? Yes, we can. And this is a lot faster. But again, if you're really fast, you're doing, 3-minute neuters and stuff, I would tell you, if you're doing neuters and you're doing scrotal approaches and you're not doing you're just gluing the scrotum, then you don't necessarily, this is going to make you even faster than that. But if you're doing ligation, then yeah, if you're ligating them with suture, then sometimes I don't always go for it, but definitely is faster. We're out of single glue in here, so.
There's nothing on the course.
No, it's okay. It's not wicked. So what other questions do you guys have regarding, as far as the usage, stays, neuters, any of the procedures? And Sean has videos of us doing, we did a 90-pound dog splenectomy. I think the spleen took all of about 9 minutes when we did it. So a lot faster process. I think we also did a gastropexy on that one too. So it's definitely here to help. But again, big differences between this and the buoyant or the ligature is going to be amount of uses per handpiece. Now with some of the newer force triad, the ligatures, there's very limited usage with the handpieces, and they are not cheap. And obviously that cost is getting pushed on to our clients, and that's not always attainable. And if you're doing, a lot of spays and neuters and you guys are good at it and you have a team that's good at it, then try to keep as much of that in-house as possible. So from a business owner perspective, this is a great piece of equipment to have, but we have all the different hand pieces that we use for this children's. So
Do you guys charge extra for use of one in a procedure?
I charge a $25 consumable fee for the handpiece, basically. So, and you figure if it's warranty for 100 uses, $25, that more than pays for the handpiece itself, plus then, extra. And I charge per handpiece. So if I use cautery and the MD1, then I charge $50. If it's because those are the two pieces that we get on the rotation kit. And the little cautery tips are, I think they're about $25 a pop. So it's a really, to me, it's not a big line item fee, and you do make it up in the long run. Plus whatever, that helps cover labor, all the other stuff that's associated with the machine.
I have a question about the forceps that come with this, the small ligating forceps. I just did about a 50-pound ruptured Clio the other day with this.
Yes.
But I was having some trouble getting the forceps to properly seal some of the larger skin vessels and things that was going in there. What are the
about these ones?
No, the small forceps, not the sealers.
Yeah. That may be just due to tissue size. I think when you're looking at the bipolar forceps, I think you have about 3 millimeters at the tip. It's not designed to do larger tissue. So if you're doing, and you also have to make sure your settings are appropriate. So if your settings are, because one of the things that we do see is that with the higher, you set it on large breed, it's going to set your cautery up to like 50 and 60.
that tends to be a little too hot. Most cases, 35 is probably the highest that you're going to need for any vascular tissue seal. And that's probably some pretty dense fat tissue that you're going to be doing. So I don't lean towards the bipolar forceps for a lot of bigger surgeries. That's more of microsurgery that you're using those for.
I was only using this for like some of the skin bleeders because she had puppies before, and it was much more vascular than usual. I use the large sealers, of course, for the uterus and the pedicles.
Okay.
Let me show you on the face of the generator, because there is something that you just want to make sure that you're set for.
Yeah. Just got some sheets.
Because when you are down here, let me just get this position down. So when you're down here on the generator and you are using bipolar forceps for coag, remember you have to be on one of the 3 blue settings. If you're on micro, it's going to be a very delicate coagulation. So if you're using for some of those, make sure you're on the standard icon, which is the middle blue icon, or the force icon in this lower right quadrant. And remember, if it is selected to rapid seal when you're on this main page, your forceps will not be activated. So make sure it says BIP coag in that bottom quadrant.
Ah, that was the problem. They were set incorrectly. Perfect.
Yep.
Thank you. That was my question.
So just make sure that lower right quadrant is on the blue icon. And remember, you have a micro, standard, and force. You might need that force icon if you're getting into a little bit bigger tissue that you need a little bit more power. And then, just make sure that it's not on the purple icon when you get back to the main screen.
Great. And then when I switch to the actual, the large sealers, I just switch back over to the sealer.
To the rapid seal purple icon.
Rapid seal purple.
And
Great.
do remember,
Thank you.
yeah, you can change that bottom right quadrant by holding down the black button instead of just touching it to move the foot pedal up or down. As long as the foot pedal symbol's in the lower quadrant and you hold the little black button in the middle of the foot pedal, it'll transition this from sealer to bipolar forceps for coag.
Oh, great. Thank you.
You're welcome.
Sorry, I should have asked a question before I jumped in and answered something.
Well, it's okay. I mean, you never know.
I had a similar question. I was using the same handpiece that you were just using for about a 70-pound spay. And on my pedicle, I was not getting a seal like how he was. And I have in other patients, but not of this size. And so I was just curious, I could not troubleshoot through getting a better seal, like a visual seal. And so is there anything that I can do to help troubleshoot? Because I felt like the tissue size was not too much with what I was trying to do. And she was on an L3 setting.
And you were getting the solid beep while it was trying to seal. Did you get an error tone at the end with an error message populating on the screen?
I did not.
So you might have been either one of 2 things. Your foot pedal symbol here could have been on the top quadrant and it wasn't activating the sealer. It was actually activating the monopolar coag pencil by accident.
It was down.
It was down?
Yeah.
And you had L3, you said there?
Mm-hmm.
What I would say, connect with us, or if you can put your info in the chat.
Okay.
I will give you a call and we can help troubleshoot for you.
Sounds great.
Yeah.
One of the things you can do just as a trial run too is just get like a piece of banana peel or something and just run a test on it and make sure that it seals.
Okay.
So just so you're just testing it in a non-clinical setting, so you're like, so you don't get, you're like, oh crap, and just make sure that it was plugged in.
Yeah. Okay.
All that stuff, because sometimes it's the most innocuous thing. For instance, I went to go use
neuter and his pedicle is thin and small, I'm going to go with a lower setting.
Okay.
So I'm not basing the setting on the size of the dog, but rather the thickness of the pedicle.
Yeah. I mean, it sounds like a heat transference.
Yeah, I agree.
It's only doing it on thin things, you said? You think it's only
It's
happening on
random.
taller
You know,
fishes?
I haven't used it. We've used it what, like 10 times, 12 times. So I don't have a big repertoire to you know, to give you details on, but I think it's random. I think I had a 4-pound spay that it blistered on, and then I had a larger one that also blistered but didn't bleed.
Okay.
But I had to watch it for a second because I didn't. And again, my concern is not on the distal side of the seal; it's on the proximal.
Yeah. Yeah. I would.
I'm going to lower the settings.
Yeah.
If I lower the settings, will it? And it'll definitely beep if it's sealed. But I'm going to try lowering the settings even more and see if I can avoid that, you know, that collateral damage.
Yeah, but you can't go less than an L1 when you're using the sealer. So
No, and that little dog was an L1.
Yeah, that's what I'm saying. You can't go less than an L1. So it's going to be hard to assume. And it may just be that the patient size and the transference, the heat transference is just too big for that patient, you know? I mean, I think it's probably something I haven't dealt with as much because I don't typically, like the smaller patients, I don't typically, oh, thank you. I do need it. Lean, you know, use it on those. Like I don't even use it on cat neuters. I just use it on, you know, most of the space.
It makes it so much easier and faster, honestly. Like
Yeah.
if I could get like a L.5, you know what I mean? Again, I was spaying a 4-pound dog. So that's equivalent to me to the pedicle of a cat neuter. And there's no other way to adjust these sealing settings below L1, you said.
L1 is the lowest setting for that. I can see if there's any way to make a alternate setting. So let me check into that.
That'd be nice.
And I will definitely let you know.
Awesome. Thank you so much for doing this and for answering all our questions.
Of course. We got one other question that just came in.
Yep. Okay, Dr. Vogel. So how do these happen? Very fast pedicles. You can't get a full bite within the clamps. You can't see where the vessels are within the fat. The best thing to do there is probably just make sure you seal. You hear the beep, and then just make sure you check before you release the clamp all the way. So you're still gonna, just like you would with any other ligature, you're gonna check your site before you drop it completely. Just make sure you're sealing all the tissue across the fat or the area that you want to seal. That you're not just sealing half of the tissue and then cutting it, because if you don't see your vessel, then you're not going to know. Sean's going back to check the thing. Okay.
Dr. Vogel, if you have any other questions regarding that, just let us know. We're more than happy to touch base with you offline or assist you in a procedure that you have coming up.
Yeah, and we're both pretty available. So if you guys if anybody's ever in a situation where they're setting it up and they're having a challenge, feel free to reach out and call Sean or I on the spot. You know, I try to get to it, especially I know how important it is to have confidence in the machinery that we're using. So just if you're ever in that situation, we try to be available to make that to be there live for when you're using it, and whether that's through FaceTime or just even a phone call, you know, we can always try to help.
Any other questions out there that we can help assist with? Well, we greatly appreciate y'all's time today, and thanks for joining us. Once again, this will be recorded, so we can send this back out to you, so you'll have it to watch back. And if you ever have any questions for Dr. Tajmir or myself or Joanna, you know, any of the Genia USA team, definitely let us know. And we look forward to seeing y'all next month. Hope y'all have a good week, and Happy New Year.
Happy New Year.